Wellstar Health is the largest nonprofit healthcare provider in the state of Georgia. About 12 hospitals, 400 ambulatory centers, and about 40,000 employees. I started this journey of eliminating shadow IT, or at least helping out understanding why it's there, how it got there, how can we alleviate it. So picture it this way is, I don't know my SaaS landscape, to I know my SaaS landscape, but I don't know who's using it, to I know who's using it but I'm not managing it, to I'm managing it and how do I know I'm managing it effectively, to I've got everything I need to know, I'm managing it effectively, my processes are in place to accept any new and incoming requests for new SaaS applications. Where do we go from here? Right. That's kind of the journey I've been on with Reco, is filling all of those from I don't know what I don't know all the way to how do I appropriately manage this and improve my maturity process and posture management out there for all the SaaS applications. I expected a number of SaaS applications. I did not expect 1,400 SaaS applications. When you look at 1,400 applications, you're like, oh my God, where do I start? Start with the ones that are really, really bad. So you can sort by letter grading, right? How bad reputationally are these applications? And then the second level is start with the largest number of impact of users, right? If it's one user on an F site, it's not that you don't care, it's that you shouldn't care as deeply, right? But if you saw an F and there's 1,000 users, you really should be concerned about that application. It helps us understand, who's using what, what's the I guess the heat map of how many people are using it, and then go, okay, well then those types of people, because you can see who's assigned to it, those are clinicians, those are medical people. Are you putting in protected health information in there? Is there a chance somebody's putting PHI in that SaaS application? Do we have a business associate agreement with them? Probably not. Let's get a BAA in place with them. Let's start to understand why are you using that tool. As we look at alerts and investigation center, it's, hey, we noticed so-and-so logged in from a foreign country, and you're like, go on. So if somebody logs in from France, I better be able to go into a ServiceNow ticket and see, oh yeah, no, they had a travel exception created for that. But if they don't, I better have a reason why somebody was suddenly able to get to Microsoft 365 from France when I don't have France immediately open. Understanding what people are using, why they're using it, how they're using it. Hey, here's one that's rated A that has 1,000 users on it. Here's one that's an F that's got 200 users on it. Are they equatable? Are they the same tool? Like, yeah, for the most part, they're the same tool for the use cases. You're like, hey, 200 people, let's get you onto this 1,000 user group. And oh, by the way, we'll introduce you to the other 1,000 by creating a team site and support it and everything else. And we'll remove the risk of these 200 individuals using that site. Just from the one smart sheet, I think we saved about 200 grand. It's helping us understand what people are doing. And also it helps us understand where people want to go, right? What do folks want out of the next iteration of the transformation of healthcare? Hey, IT, go find tools that can support this. Where are you getting that information from? Well, I found 500 doctors signed up for this account yesterday. We may want to start understanding what that software does and what direction it does it. This is probably the best tool. We've got an added benefit of all this alert system and threat monitoring almost, and really kind of pulling this together.